In this video, we'll discuss about neural tooth defect. We can diagnose neural tooth defect really fast. So early in second trimester, we do that maternal serum. We collected that maternal serum. We find out that alpha fetoprotein level increases means chances for neural tooth defect. If that maternal alpha fetoprotein level are much higher, more than 2 to 2.5 times higher, then the baby affected with the neural tooth defect chances are very high. So 2 to 2.5 times higher means chances for neural tooth defect. We can diagnose and subsequently can confirm with amniotic fluid test also. By using amniotic fluid also we collect, we can confirm. So main one is serum, maternal serum, then one is amniotic fluid. In amniotic fluid we can test by acetylcholine esterase enzyme. So here we can find out acetylcholine esterase. So in serum, alpha fetoprotein level increases. In amniotic fluid, acetylcholine esterase. Second diagnosis, ultrasonography. In ultrasonography, detailed ultrasonography in that second trimester, almost 90 to 95 percentage of that open neural tooth defect can be diagnosed on that sonography. So 90 to 95 percentage open neural tooth defect can be diagnosed by using sonography. This acetylcholine esterase also give us an idea about whether the baby has neural defect or not. So by using ultrasonography, 90 to 95 percentage open neural tooth defect can be diagnosed on that sonography method. So a treatment start from the prevention of neural tooth defect. We know that folic acid is the magic bullet. So we start folic acid in that mother. We can prevent mother from having a neural tooth defect affected pregnancy. At once neural tooth defect happen, there is no cure for that baby. Suppose if that baby um, is born with a spina bifida defect, we have to take baby immediately for surgery to close the defect. Otherwise it can get infected and that can leads to other morbidity. So once that baby have defect, immediately we start to surgery, otherwise it leads to morbidity. If the baby is having some teethed cord, here the cord is attached to that lower part of that spinal cord, and as the baby grow, that the nerve fibers get stitched, and that baby get more and more symptoms with that teethed cord, the cord attached to that lower part of that spinal cord. As the baby grow, that nerve fiber get stitched, baby have more and more symptoms. So surgically release the cord. Here surgically release the cord so that that baby can get rid of that symptoms. Other common complication of neural tooth defect is a hydrocephalus. Here the hydrocephalus condition, here there is the collection of CSF or brain fluid surrounding the parenchyma. And to treat hydrocephalus, most of the time to put a stent. in that baby head like a tube. It drain the surrounding fluid. So next one is another most common thing we seen in that babies, that is lot of difficulty in that ambulation and the morbidity. They need lot of support in that form of praises, wheelchair, a lot of physiotherapy, family support for this baby for that actual morbidity. These babies have some urinary retention and multiple urinary tract infection. So, these are bladder surgeries help the baby to make them continent as well as they need multiple catheterization to prevent them socially acceptable. Many of the time give antibiotics to prevent urinary tract infection, and kidney damage can be prevented in that early stage. So urinary retention and multiple urinary tract infection, they will do that bladder surgery. Then they will take antibiotic to prevent UTI infection. Then kidney damage can be prevented in that early stage. So in this video discussed the neural tube defect. This one early stage only we can find out that alpha fetoprotein in serum high more than 2 to 2.5 times higher means chances for that neural tube defect. Then amniotic fluid test that acetylcholine esterase level increases also. Then ultrasonography we can find out 90 to 95 percentage. Then treatment, folic acid is the magic bullet. So we will take that folic acid. If the baby having third cord, here it will attach to that lower part of that spinal cord when that baby will grow. The hydrocephalus condition, here the collection of CSF or the brain fluid surrounding that parenchyma. So it is a tube. So by using that one we will collected that stunt. We can collected that extra fluid surrounded that brain part of that baby. In the case of urinary retention, multiple urinary tract infection means we want to take UTI that antibiotic and bladder surgery. So thanks for watching.